Hi, my name is Anaya and I'll be teaching the proper way to shave a patient. So if you are going to shave a male patient, you want to ensure privacy and proper hygiene. So I'll be starting off by proper hand hygiene. You want to go ahead and check the care plan and make sure to know what products to use on your patient. You also want to make sure to know if your patient has any skin problems or issues or any uh, infection on their skin, to any safety measures that you will be using. So once you have your equipment ready, in this case I'll be doing the procedure on myself since I don't have a patient. I'll be trying to explain at the best of my ability with examples since I don't have the proper equipment. In a more professional environment, you'll have the proper equipment. So then once you have gathered your you want to gather a basin with water, and then you want to check the temperature, and you want to always let your patient test the water as well and let them know is that the proper or any preference of temperature they would like. And then once you have gathered your basin with water, the shaver, and shaving cream or lotions, anything, you want to check your agency's policy as well with what kind of equipment you will be needing to do. So then you'll want to put on your gloves. And when you walk in the room, you want to ensure privacy. You want to always introduce yourself to the patient. You want to make sure they're comfortable. You want to frequently ask them, are they feeling comfortable with what you're doing to them? You don't want to make them feel uncomfortable at all. And you don't want to cause them any pain or harm. So you want to make sure to always let them know what you're going to do. It's very important. So I'll be using this bowl as my basin, like an example. So I'm pretend to have water here. So by checking the temperature, I'll use like my arm right here. You'll check the temperature, make sure it's okay, not too hot, not too cold. Then you would want to have a towel near you. And then your products, of course, I'll use this as an example. This could be my shaving cream, my lotion, aftershave cream. And then you want to have a towel. You want to, when shaving, you want to put a towel at the back of your patient like this, and make sure it's covered right here, like right here on your patient, to make sure that it doesn't get wet or anything. You want to put your patient in a comfortable position in the bed. Make sure to if they could assist themselves, of course, help them sit up. If they can't assist themselves, you could raise the bed up in a comfortable position. Then you want to grab your razor. I'll pretend that this is my shaving cream. You know, put shaving cream everywhere. Make sure that with your gloves you lather it up and very evened out and all over the surfaces. So when you shave, you want to make sure to shave in where your hair is growing, where the hair is growing. So if the hair is growing downwards, which is most likely how it will grow downwards, you want to shave. You want to grab the face and make sure you're shaving with a tight skin, you know. So you want to slightly pull, and you want to shave downwards in long strokes. Downwards. That's if the hair is growing down, of course. Always remember, it's very important to shave in the direction the hair is growing to prevent ingrowns and cuts and things like that. So you want to shave downwards in long strokes, gently. And that is for the cheek area right here. When you are doing the neck and chin area, you want to do short strokes. Or the lip area as well, very short strokes. You can ask the patient to do their mouth in this position to avoid cutting the lip or anything. And then for this, like I said before, long strokes, and then neck and chin and lips, short strokes. Remember to do it very gently and don't rush. Be very very careful to not prevent any cuts and sort of things like that. There's different shavers you may use. There's safety razors, there's electrical ones. Always make sure to know what kind of razor you'll be working with. Keep in mind you may sometimes cut the person in any way, like nicks and cuts. So if your patient does bleed, the first thing you need to do is apply direct pressure on where the person is bleeding their face. So if I'm cut my cheek area right here, you want to go ahead and apply pressure when the bleeding is at. And once you have shaved the person's face, you want to ask the patient, do they want any after shaving cream or shaving lotion or anything like that? If they say yeah, you can go ahead, spread evenly out on the face. If they don't want to, then you don't. It's all on the patient's preference. Once you have done so, you'll go ahead and remember, when shaving, after every stroke, you put the shaver in the water and rinse the razor out after every stroke. Try to do it as frequently as possible. So one stroke, you put it back in water, and then you do the short stroke, you put it back in the water. It's very important. Once you have completely shaved your patient, you want to go ahead and take off your gloves. You want to ask the patient, are they okay with how you shave their face? Is it okay? Are they comfortable? Are they in any pain or anything like that? And then you want to provide you want to do hand hygiene once again. And then you allow the patient, if they could assist themselves, you could let them dry their face alone to provide and promote independency. But if they cannot assist themselves, then you could go ahead and grab the towel and never rub against the skin. You want to gently tap on the face. You want to tap it. You want to pat it out. You never want to roughly do on the face, because keep in mind your skin may be sensitive as well, as you are working with older people. And once you are done, you want to take any observations and report to the nurse all the observations you had to do. And that's it. Thank you.